Hi everybody. So I haven't made an update in a little while just because I haven't had any big milestones happening since the surgery. I've had a lot of little things change. So I didn't want to make a bunch of little videos on what's happened. I decided to just make one big one with everything that's happened lately. So I'll just get right into it. It's been about 5 months since my surgery. I had my surgery in July. And I have had a couple orthodontist appointments and one oral surgeon appointment since I made my last video. My orthodontist appointments have been pretty much normal, just changing my elastics and stuff. They told me probably a month ago that I could stop wearing my elastics in the triangle form during the daytime. I only have to wear them at nighttime now, which is pretty good, but it gets hard to remember. But that was alright. At first it was a little bit achy to not wear it all day because it took some time to get used to, because then my jaw had to do all of the work by itself and it didn't have the elastics to pull my mouth shut by themselves anymore. So I also have had my oral surgeon appointment. I had that last week, and they said everything is looking good. Everything looks like it's healing. They took some x-rays to see that if all my plates and screws in my face were still like in the same spots, and to make sure that they looked right, and they did. I talked to my oral surgeon about my nose problem. You can see my nostrils are like still a little bit off. They just don't look exactly the same. They don't match or anything. And they never did before, but my nose, it feels uncomfortable. So I told him that I think my nose is still out of place. My cartilage in my nose after the surgery, as you can see in my previous videos, got pushed out of place by the swelling, and they told me it would go back on its own. But it didn't, so it's still over to the right. It's like my cartilage just kind of curves right here and it just goes over. So I wouldn't have had to go back and see my oral surgeon until I got my braces off if it wasn't for my nose, but I had to make an appointment in 2 weeks to go talk to them after they review all of my x-rays that they took, so they can see what's the best plan to fix my nose. But other than that, everything's good. So I'll update you guys on pain and numbness and anything else that pops into my head in the next few minutes. So pain, no pain at all. I don't feel any pain. I get a little bit achy at the end of the day, but not terribly. Like, I don't have to take anything for it. I just go to sleep and wake up and then I'm fine. Every once in a while, I will get like a really sharp pain right here on this side of my mouth, but it'll only last probably like 10 minutes. I put my elastics on and then I feel fine, which isn't that big of a deal. I'll just take some like regular Advil or something like that, or whatever, ibuprofen, that'll help that, and then I'll be fine. Numbness, I am still numb right here. My whole bottom lip and all my chin in here is still numb. When I touch it, it feels like tinglies, like pins and needles, I guess you could say. I can feel hot and cold on my face now. I can feel cold better than I can feel like heat on it though. I can feel the roof of my mouth in like small little patches, like it's coming back patchy, just like my face did. I can't really feel my gums that well unless if I'm brushing them. These gums I can't feel at all. My bottom gums, I can feel like a little bit in patchy places, just like the roof of my mouth, but that's it. It's a lot better than it was before, maybe just because I'm getting used to it or something. I have no numbness up here in my face or anything. Right here, it just feels a little bit funny. I don't know how to explain it. It's just like when I touch it, it feels kind of dull to touch it, but you can still feel when something's touching right here on my face. So that's where I am with pain and swelling. Let me think of anything else that I have. I have an orthodontist appointment tomorrow morning to get just my wires tightened. They started filling in the gaps. They put gaps between these teeth before the surgery. That way they had enough room to push my jaw back and my teeth wouldn't touch and get in the way. They put the power chains on them. I don't know if you can see them, but I'll show you. They put power chains on them. This is where the gaps are. They still a little bit of gaps right here and right here. So they're taking those out, and then they're also doing a process. I don't even know what this means really, but they told me it wasn't painful. I hope they're not lying, because I'll be pissed if I get in there and it hurts. They're shaving my teeth. That sounds so ridiculous, like I don't have hairy teeth or anything, but I have triangle shaped teeth. I can show you, like, so the widest part of the triangle is at the top and my teeth go like that down, so this would be like where my gums are, and this is the top of my tooth. So when my teeth touch together, there are spaces between my teeth down by my gums, so they have to thin out the top part of my teeth, that way all my teeth can come together. That has nothing to do with the jaw surgery. It's just another thing that they're going to have to do to make my smile look better. I think that's really all I have to update on. Not so bad, feeling really good. Nothing really bothers me anymore. I can eat a lot of things. Some things I have a difficulty with just because of pressure. Sorry, that's my dog. Get down. Some things I have a little bit of a problem with because of trying to put pressure on this part of my teeth. Like if I try to bite something with my front teeth, the pressure right here kind of bothers me. But biting anything with my back teeth doesn't really bother me anymore. That feels like normal. I can eat crunchy things. I haven't tried like steak or anything yet. And one thing that I'm saving till probably like a year after the surgery is chewing any kind of nuts, like peanuts. That sounds really dirty. But like peanuts or cashews or anything, because I heard that that's the toughest thing to eat after surgery, just because they're so hard to break and they don't mush at all. So I haven't yet tried those, but I will in the future, and when I do, I will let you guys know how it goes. So I guess I will show you guys my smile and my front and side views, and then that'll be it. So, okay, here's my smile. Looks pretty good. I'm pretty happy with it. The oral surgeon said to me the other day that he's really happy that I went through with the top and bottom jaw surgery rather than just the bottom jaw surgery, because I would not have gotten the best results. They would have been good, but the way my face and profile and everything looks now would be better than if I just did the bottom. I am 100% happy that I did the surgery. I don't regret anything. I don't regret it at all. Even if I didn't get feeling back in my bottom lip or chin, I don't regret it. So yeah, just putting that out there, because at first I was a little bit nervous because of how awful I felt after, but I feel really good about it now. So, okay, this is my smile again. And then the sides of my face. And this is the side of my face when I smile. Okay, and then this is the other side of my face. Let me see. And then this is the side of my face when I smile too. Alright, so yes, feeling really good. Keep sending me questions. I answer them at least like once every couple days. You can send them to my private inbox, because I just think that's the best way to answer questions, because people get nervous about posting. And then you can always email me. My email's on there too. So yeah, thank you guys so much for watching. And if you guys if you guys need me to post any more videos about anything, just let me know and I will. I'm really bad about posting videos, but I send other people videos, personal videos all the time, talking to them, or I'll webcam with people about my surgery. So just let me know what you need to know and I'll answer. Alright, thank you guys. Bye.